Okay, everyone, my name is Mao Shengxia, and today we will talk about fractures introduction. There is no class of injuries with a percentiler approach with more doubt and misgiving than fractures, or one which demands a great amount of ready knowledge, self-reliance, and consummate skill. So let's talk about section 1, definition, cause, classification, and displacement. What is fractures? Fracture is the integrity and or the continuity of the bone be interrupted. So what is the cause of the fracture? The first one is direct violence, means violence direct to the bone, then the fractures happened. The second one is indirect violence, that violence translated to the bone, then the fracture happened. From the picture we can see the patient's hand touch the ground, but maybe his thorax have fractures. That this is the indirect violence. And the third one is the fatigue fractures, means long-term repeated and minor extra force, that the stress accumulated that make the fractures. This is the fatigue fracture. And the fourth is the physiological fractures. That means if the bone have some disease, many slight force can make fracture. And the third one is the classification of the fracture. First one is according to the skin and muscles of the fracture, that there are two kinds of fractures here. The first one is open fracture. That means the edges of the fragment and the air are interlinked. That means the edge of the fractures is dirty. And the second one is closed fracture. That means the edge of the fractures and the air are not interlinked. That happens every day, and that means at this time the edge of the fracture is clean. And the second one is according to the severity and the shapes of the fractures. First one is incomplete fracture, that the integrity and or the continuity of the bone be interrupted incompletely. The first one is linear fracture, and the second one is green stick fracture. We can see from picture, this is the green stick fracture that happens in children, some young people. And the second one is complete fracture. That means the integrity and or the continuity of the bone be interrupted completely. And according to the fracture line and the shapes, the first one is transverse fracture. You can see this from the picture. And the second one is oblique fracture. We can see this is from the picture on the right. And the third one is spiral fracture. Community fracture. We can see from picture that is commutation fracture. That means there are many pieces of the brick bone. The number 5 is impact fractures. That is the fracture, the fragment of the fractures compact into another one. And the number 6 is compression fracture. That usually happens in the spine. And the number 7 is epiphyseal separation. According to stable or not of the fractures, there are two kinds of fracture. First one is stable fractures. That is the edge of the fracture is not easy to move and is stable after reduction. And the second one is unstable fracture. That means the edge of the fracture is moved again very easy. And according to the time, the first one is fracture. It's less than 3 weeks, means fracture. And the old fracture, more than 3 weeks, is old fracture. There are 5 kinds of most common types of displacement. The first one is angular displacement, and lateral displacement, torsion displacement, separation displacement, and rotating displacement. Section 2, clinical massification and X-ray examination. General manifestation. First one is shock, and the second one is fever. The fever body temperature is less than 38 temperature. Local manifestation. First one is the pain, swelling, and some other local manifestation. And there are some special signs of the fractures. First one is disformity, and the second one's abnormal movement, and the third one is bony characters. X-ray examination is very important for the fracture. It have an important value to make sure that fracture is happened, and the treatment, also for the treatment of fractures, is very important. Section 3, fractures affecting the healing of fracture. First is the systemical factors. First one is age. Sometimes children's fractures will heal faster, and old people's fractures will heal slowly. The second one is healthy status. Some local factors also affect the fracture. First one is types and the qualities of fractures fragment, and the blood supply of the fracture fragment, and the soft tissue injuries, and the soft tissue insert, and the infections all can affect heal of the fracture. The third one is the influences of treatment. First one is repeated Guernica reset, and the second one is open reduction, and the third one is improper of the treatment of the open fractures, and some other, for example, the weak fixations, all can affect the treatment of the fracture. Section 4, standards of fractures clinical healing. First one is no local tenderness and longitudinous type pain, and no abnormal activity, and X-ray shows fracture line is obscure. I think the first three is very important, and I don't think that we should let the patients move or walk for 3 minutes. I think if X-ray shows fracture line is obscure and there's no abnormal activation, that means the fracture is healed. Section 5, the treatment of the fracture. There are 3 very important parts of the treatment of fractures. First is reduction, second one is fixation, and the third one is functional exercise. First is the reduction of fractures. There are 2 kinds of reductions. The first one is anatomical reductions, and the second one is functional reductions. We can see from pictures. On the left side is the fractures, on the right side is the reduction of fracture. Based the rule of reductions, that means we should not try more than 3 times, and we should track the X-ray after the reduction, and we should take care of the patient's situation, and we should do the reductions very tenderly. Open reductions indication. First one is soft tissues impairment, and sometimes in the intra-articular fractures and a few of close reductions all lead to open reductions. Sometimes the multi-fractures and some other times we need open reductions. That means we need to do the operation. Second one is fixation. Fixations, there are 2 kinds of fixations. First one is external fixations, and the second one is internal fixation. Here is some pictures of the external fixation, and here is some X-ray images of internal fixation. What you face is complicated. That I think there are many kinds of in the fictions. The third one is functional exercise. There are 3 times: early time, advanced stage, and the later period. So thank you for your attention.